in relation to Ramadan, Ramadan is fast approaching, maybe less than 10 days now. Um, do you have to fast? Or because of the coronavirus, spread of coronavirus, even those individuals that are until now well and don't have any illness, can they miss the fast, delay the fast, give fidya, etc., because they fear that by fasting exposes them to a deficient immune system. It will decrease their immunity. There are some studies on this area, not a lot, but there are some studies on this area, and the results are actually quite inconclusive. Okay, they do not show that there is any significant reduction in immunity. In fact, some show the opposite. So the results are inconclusive. So my opinion is that there is no conclusive evidence to say that by fasting you will make yourself susceptible, more susceptible to coronavirus. There is no evidence at all to say that, and so that should not be a reason currently to for a person to forgo the fast. However, those that are caring for COVID-19 patients, and because they are caring for COVID-19 patients, have two things that they have to do. One is they have to wear the full PPE, and because of that they sweat a lot and they are at risk of dehydration and also making clinical errors. And secondly, they have long shifts. Okay, so the combination of both of them means that they will reduce, they will dehydrate, and they are at a real risk of making clinical errors. They are able to delay the fast. Now here I put very deliberately, I put healthcare staff required to provide care. If they are not required to provide care, for example, they can take annual leave in Ramadan rather than treat COVID-19 patients. They can take annual leave. They should take annual leave. Or they can do the night shift, for example. Or night shift don't really matter. The time between iftar and sahur is too small. There is, for example, they can work alternative days or etc. They can in some way continue their fast and continue also treating the patients. Then they should do so. But if they are required, the Muslim staff, they are required, contractually obliged to work. They are not able to get annual leave, and in this situation, you wouldn't be probably able to get annual leave when it's the case of all hands on deck and get. When you are training the people that are not trained and disciplined to work with the COVID-19, and you're fast tracking the healthcare staff to beyond what the normal skill set is, then those people are already in that area, or those people that are working in the area should and are not going to get days off really unless they get ill. So those are staff that are required and cannot get time off to provide care to COVID-19 patients and are at real risk of dehydration and making clinical errors. Why? Due to wearing PPE and due to long shifts, because they have extended the shift. The less amount of staff they extended the shift is quite long. Some of the staff you have seen, they're wearing PPE, they come up with bruises on their faces, etc., etc. So it's not a normal situation. This is not normal. This is extended shift, long shifts, exhaustive work, wearing full PPE, where the staff is perspiring and a lot of sweat, and they are at risk of dehydration and making clinical errors. Those staff, they can forgo their fast and fast at a later date. And this is based on the situation of the fuqaha. The several situations the fuqaha mentioned. They mentioned, for example, a nurse looking. In fact, the example is there in the books of fiqh, in Shami and in Fatawa Ibn Abidin's Rad al-Mukhtar, of a nurse who's looking after the sick. A nurse who's looking after the sick. If she fears that he fears that by fasting it will compromise the care of the patients, the person can delay the fast. A wet nurse, somebody who's feeding the child, feeding milk to the child, whether it's the mother or it's somebody paid to do that, they fear that by doing so it will harm themselves or the child, they can delay the fast. Those also you find mention of those contracted workers that are required to work and cannot and need, for example, need the money. They have no option but to work. If they don't work, they don't eat. Then those people also can delay the fast. So we have examples in our fiqh of of where staff, people that are required to work and in challenging circumstances, they can delay the fast. However, this is very much a decision of the individual, because not everybody is the same. Some people might not sweat as much, somebody might be able to go more, etc., etc. It's very much down to the individual. However, in such an environment where you are treating patients with COVID-19, I have to wear the face mask, etc., a lot of perspiration, and you are at risk of making errors. In such situation, you can forgo the fast.